Cancer, the six-letter word no one wants to hear. What next? It's a scary road, but we'll navigate it together. With modern medical advancements, cancer care has come a long way. On this channel, we'll focus on the treatments, covering topics such as cancer types, therapy types, clinical trials, the cost of treatment, and potential treatment side effects. As a pharmacist with over 10 years' experience specializing in cancer care for the last 6, my goal is to help educate and share the evidence. Let's get into it. What is cancer? Cancer occurs when something goes wrong with the cells in our body and they begin to grow out of control. These cells develop into tumors, which can then spread. There are over 200 types of cancer. To keep things simple, they can be broadly categorized into two main types: solid tumors and liquid tumors. Solid tumors can occur anywhere in the body, such as the lungs or the breasts. Liquid tumors, often referred to as blood cancers, develop in the blood, bone marrow, or lymph nodes and travel through the body and the bloodstream. The severity of cancer can be measured in a few different ways. One of the most commonly known methods involves staging from 0 to 4. Stage 0 is for abnormal cells that have not spread and is not considered a cancer, but could become cancerous in the future. This stage is also known as in situ. For this reason, it is not included on the table below. Stage 1 or 2 means the cancer has not spread very far. Stage 3 or 4 means it has spread more. Stage 4 is the most advanced and severe form of disease. Treatment will vary depending on type of cancer and severity. Another system involves grading the cancer, in most cases using a standard 1 to 4 grading scale. A cancer is considered grade 1 when tumor cells and tissue look most like healthy cells and tissues. These are called well-differentiated tumors and are considered low grade. Grade 2 are intermediate grade tumors where the cells and tissue are somewhat abnormal and are called moderately differentiated. Grade 3 cancer cells and tissue look very abnormal. These are considered poorly differentiated and are considered high grade. Grade 4 cancers have the most abnormal looking cells. These are the highest grade and typically grow and spread faster than lower grade tumors. Another common staging tool is the TNM system, which stands for tumor, node, and metastasis. When a patient's cancer is staged with TNM, a number will follow each letter. This number signifies the extent of the disease in each category. The table below shows the breakdown for this system. The most common treatment options are surgery, chemotherapy, radiation, targeted therapy, immunotherapy, hormone therapy, stem cell or bone marrow transplant, and gene therapy. Surgery involves the physical removal of tumors or affected tissues and is often the primary option for localized cancers. Chemotherapy utilizes drugs to halt or kill rapidly dividing cancer cells throughout the body. Radiation therapy employs high-energy particles or waves to target and destroy cancer cells, minimizing damage to surrounding healthy tissue. Targeted therapy focuses on specific molecules involved in cancer growth, disrupting their activity and sparing normal healthy cells. Immunotherapy harnesses the body's immune system to recognize and attack cancer cells. Hormone therapy aims to block or remove hormones that fuel certain cancers. Stem cell or bone marrow transplants involve replacing damaged cells with healthy ones. Gene therapy is a newer treatment where faulty genes responsible for cancer are replaced. Various treatments may be done alone or in combination depending on the patient and cancer. Clinical trials are carefully designed and conducted research studies that aim to evaluate the safety and effectiveness of new drugs or treatments, or new indications for existing drugs or treatments. Clinical trials are usually done in phases as evidence is developed. Phase 1 studies focus on the safety and dosage of the treatment in a small group of participants. Phase 2 studies assess the treatment's effectiveness in a larger group and further evaluates safety. Phase 3 studies compare the new treatment to standard treatments in a large group to determine effectiveness, monitor side effects, and collect additional information. Phase 4 studies are for drugs that have already been approved and run over a much longer period of time. These studies follow much larger patient populations to study the safety of the treatment over time. Patients interested in participating must meet specific criteria such as age, gender, medical history, and type or stage of disease in order to be eligible for these trials. In the event that a patient does not meet these criteria, it is still possible for the study sponsor to make an exception. The patient may then end up being treated following the study protocol. Participation is voluntary, and those interested in enrolling receive detailed information about the trial and must provide informed consent prior to starting on a trial. It is important to note that a patient can always drop out of a study at any time and for any reason if they choose to. Time and again, we hear about the rising cost of healthcare. The estimated cost of cancer treatment in the U.S. has grown to over $200 billion annually. To put that in perspective, that would be the equivalent of every one of the 333 million people in the U.S. paying $600. In 2019, U.S. patients paid an estimated $16.2 billion in out-of-pocket care and lost almost $5 billion worth of time. Reports show that during the first year of a cancer diagnosis, patients 65 and older averaged $2,700 in out-of-pocket and lost time costs. For younger patients, this number was even higher, with an average of $5,900 in the first year after diagnosis. With the new innovations in treatments, the cost of medications is skyrocketing. However, there are also other costs to consider, such as transportation and lodging during treatment, and lost wages or income for those unable to work while getting treatment. Many factors come into play and can affect the total cost of care. Treatment often comes with side effects, which vary depending on the type of therapy. It can be an isolating experience for many individuals, with the emotional and physical toll of the disease and treatment leading to an overwhelming sense of loneliness. Life changes, and the fear of burdening loved ones can further contribute to feelings of isolation. It is so important to remember that you are not alone and that there are resources and support available to help you every step of the way. If you or a loved one is going through this, you know it sucks and there's never a right time. Leave a comment below to share your story and let anyone struggling with this know that they are not alone. We are in this together. Please note that this video is not medical advice. Each of us is different, and individual patient factors will always affect the best treatment option. Your oncologist and medical team will be the best ones to evaluate and guide your treatment plan. Our goal is simply to share the facts and evidence to help you make an informed decision, and to create a community to help support you or a loved one during the treatment journey. Thank you so much for your time and attention. If you found this video helpful, please share it to anyone you think it could help. Cancer care is a rapidly developing and complex topic. Stay tuned for more videos like this covering various topics, and we'll see you on the next one.